Receiving a reactive rapid test can be scary, shocking, and unexpected. Knowing some information about what the test result means and your next steps can help alleviate some of those feelings. Let's start by covering what HIV is. Human immunodeficiency virus, or HIV, is a virus that attacks the body's immune system, making it hard for the body to fight off infection. HIV is passed from one person to another through blood, semen, vaginal fluids, rectal fluids, or breast milk. One of these fluids has to come into direct contact with a mucous membrane, damaged tissue, or be directly injected into the bloodstream. Examples of how transmission can happen can include unprotected vaginal sex, unprotected anal sex, sharing injection drug equipment, or breastfeeding. HIV cannot be transmitted through casual contact such as kissing, hugging, sharing a drink, or sharing eating utensils. Common symptoms for HIV can include sore throat, swollen lymph nodes, night sweats, mouth ulcers, and other flu-like symptoms. Symptoms can appear within 2 to 4 weeks after transmission. It's important to note that symptoms for HIV can vary from person to person. Some people might not experience any symptoms. The only way we can know if an infection is present is by testing. So if you do have symptoms, we recommend getting seen by a provider or a doctor. What is the difference between a rapid test and a confirmatory test? Rapid tests, like the ones done here at HeyDenver, are very accurate preliminary tests. Rapid tests are used to screen for infections. They detect antibodies and not the virus itself. If you have a reactive rapid test, your next step is to get a confirmatory lab test. If you're waiting for confirmatory test results and are anxious about having to tell partners, know that at this time it is not a step that you have to take on. There are people that can help you through that step if your confirmatory test does come back as positive. The term reactive is used for rapid tests since it is still considered a preliminary test, although they are very accurate, and a confirmatory test is needed to confirm the infection. While we accept that HIV is no longer the death sentence that it once was, we know that receiving a reactive rapid test result can still be scary and shocking. We bring you this information so you can be informed about your health and be knowledgeable about your next steps. While there is no cure for HIV, it is now seen as a chronic health condition that can be treated for life. HIV is treated using antiretroviral therapy, or ART for short. There are various regimens that are used to treat HIV, and new advancements are coming out every year, like long-acting injections. Treatment plans for people living with HIV are tailored specifically to each individual's needs. If your confirmatory test comes back as a true positive, your doctor will go into treatment more in depth. Regardless of HIV status, HeyDenver believes that everyone should know about an undetectable status. When someone who lives with HIV has the virus suppressed or under control through the use of antiretroviral therapy, their status becomes undetectable. This means that a person's copies of HIV are so low that it's virtually impossible for transmission to happen through sex. We recommend talking with your provider about prevention tools you and your partners can use, including HIV treatment, PrEP, PEP, condoms, and discussing recent test results. If you need a list of places where you can access treatment, check out our description below. You'll find a link to our website where you can find clinics and testing sites across Colorado. And if you need further guidance, feel free to reach out to HeyDenver and we can help you.